everyone, my name is Aldrika Hill, and I am making my video in regards to the completion of 40 clinical practicum hours. Um, I have incorporated the determinants of learning by assessing students in the classroom learning environment. This is observed through students actually listening to the lecture part of class. This is the students taking notes, being proactive. Students use a lot of highlighters in their books to highlight pertinent information. Another thing I have observed is students use and learn by demonstration. When I say demonstration, one of my preceptors had this scenario where one of the students was asked to step out of class and to come back in for like a quick minute, and all the other students that were left in class, she asked them to describe the overall assessment of the students. So some of the answers were that he was tall, he had a good attitude, what color mask that he had on. So her overall focus was so that the students can understand how you do a quick assessment on your patients when you walk in a room, just to determine that they're okay before you start doing any type of care or anything on them. Another determinant of learning is the fact that one of my preceptors brought up that students are not taking the time to read into test questions. And the example she gave is they had a test where it asked, what are some of the side effects of digoxin? So, no, I'm sorry, what are not the side effects of digoxins? And so the answers were on the test were headache, blurred vision, nausea, and diarrhea. And we all know that 3 of those are the side effects of it. So what they did is they chose blurred vision, but they did not read into the part where it says what is not a side effects of dig toxicity. So far in my clinical experience, I have created a teaching plan on cirrhosis of the liver. And I was able to teach a class with this, recording myself voice over PowerPoint. Some of the objectives I have achieved: I have assessed the learning needs of students. I have used information and communication technology such as with Zoom. I'm sorry, y'all. I've used assessment to determine how students learn, determine appropriate classroom and clinical teaching skills. I have identified a problem such as with cirrhosis and been able to teach on that area of specialization. Legal and regulatory professional standards, the standards of the school, the code conduct, explaining that to students, the conduct of Zoom, being able to participate in Zoom meetings, knowing that information is shared, that information is locked, not letting people in Zoom meetings that don't belong there as well. Some teaching theories I have mostly utilized is Pender, and it is talks about health promoting behaviors, such as the example I gave with cirrhosis of the liver PowerPoint. Some things you can do to avoid having cirrhosis, such as not drinking, not taking too many drugs. As I said, I have taught a class for my preceptor. Some of the best clinical experience I have had so far is basically that demonstration with the student stepping out and coming back in, and just seeing how the students have such a hunger to learn, just seeing their eagerness to become nurses. And so that is my video, and thank you all.